C. Charlton Mabry arrived on the Maryville College campus in 1947 following graduation from Knoxville's Central High School. Chart, as his friends and family members call him, was a serious student who majored in biology and spent hours in the classroom and laboratories of professors such as Susan Green Black, Fred Griffiths, Lyle Williams, and Bonnie Hudson Brown. As an undergraduate, Charlton got outside. Some. He was a member of the college's track and cross-country teams, and when high school sweetheart Barbara Blum showed up on campus as a freshman in 1948, he had another reason to break, if only momentarily, from the books and microscopes of biology. Completing a special studies project on homeostasis and hemorrhagic diseases and graduating cum laude from Maryville College in 1950, a year ahead of his classmates, Charlton was accepted into Emory University School of Medicine. 2 years later, he and Barbara were married following her graduation from the college. Charlton earned his medical degree from Emory in 1954 and was drafted into the Navy as part of the doctor draft law. It was in the service that he decided he didn't want to pursue internal medicine or surgery. Instead, he came to believe that a career in pediatrics would be especially rewarding. Little did he know then how worthwhile his work would be for countless children and families. After military service, Charlton entered Temple University School of Medicine and began a general pediatrics residency at St. Christopher's Hospital for Children in Philadelphia, Pennsylvania. He became the first National Institutes of Health Fellow at St. Christopher's and spent 2 years studying pediatric endocrinology and metabolism, producing several landmark publications on hypoglycemia and other metabolic problems. Chart had found his calling. At about this time, Kentucky Governor Albert B. Happy Chandler was pushing for the establishment of a medical school and university hospital. Charlton was recruited to Kentucky as a promising young pediatric researcher, and in 1961, just a year before the A.B. Chandler Hospital opened, our MC alumnus joined the staff. He began as a bench researcher clinician, transitioning into clinician clinical researcher. In 8 years, he went from instructor in pediatrics to professor of pediatrics and then added professor of pathology to his title in 1971. He directed the hospital's birth defects center for nearly 15 years and was associate director of clinical laboratories at UK's Chandler Hospital for 3. For the medical school students he has mentored in his 50-year career, Charlton has been an outstanding example of professor, physician, and researcher. Charlton's research has been published extensively. He has published 4 papers in the prestigious New England Journal of Medicine, the first occurring in 1963, when he and other researchers found that 1 to 2% of the mentally retarded in institutions were the result of maternal fetal ketonuria. It was a major finding, and his research on the phenomenon would bring Charlton international recognition in the medical community. Phenylketonuria, also known as PKU, is a genetic disorder that is characterized by the inability of the body to utilize the essential amino acid phenylalanine. The condition leads to mental retardation and seizures, but with early identification, treatment, and adherence to a low phenylalanine diet, patients can lead normal lives. Charlton traveled into rural Kentucky to find newborn siblings of older PKU patients, and he screened them for this disorder. For those who tested positive, he got them into a care system and followed their treatment. In many cases, he followed their treatment and development for decades. In addition to maternal PKU, Charlton has conducted research and written extensively on other inborn errors of metabolism, diabetes, and Graves' disease. Mabry muscular dystrophy was named in recognition of Charlton's research of an X-linked muscular dystrophy that appears in individuals between the ages of 5 and 35. He became something of an engineer, too, in 1961, when he took materials purchased from the Sears and Roebuck Company and built a high-voltage paper electrophoresis system that would replace paper chromatography. A few years later, he would develop automated microchemistries in a clinical chemistry lab, allowing the hospital to open a neonatal intensive care unit. Closely connected to Charlton's study of metabolic diseases is the screening for their existence in newborns. Passionate about the power of early detection and early intervention, he was instrumental in Kentucky's first newborn screening legislation in 1966 for PKU. 4 other tests were mandated in the years following, but in 2003, Mabry set out to expand testing to 29 disorders. For 2 years, he traveled regularly to Frankfort, Kentucky, to lobby members of both the House and Senate Health and Welfare Committees. After much political arm wrestling, Senate Bill 24 was signed by Governor Ernie Fletcher on March 1, 2005. As a result of the expanded screening, 44 disorders can now be identified, saving an estimated 100 or more babies annually from mental retardation, blindness, deafness, and even sudden infant death syndrome. Soon after passage of that historic bill, UK's Department of Pediatrics dedicated its metabolic disease unit in honor of Charlton Mabry. For his efforts to expand newborn screening, he was recognized by the Kentucky legislature in 2008. Technically, Charlton was professor emeritus during all of this, but there's not much about his life that says retired. Today at age 80, he still cares for children with heritable metabolic disorders and does clinical correlations. He takes part in international drug studies. Just last week, Charlton and his wife Barbara, his chief critic, editor, and team member of 58 years, celebrated the release of First 50, a pediatric story, which he wrote and she edited. The 256-page book chronicles the medical care of Kentucky children before and after the establishment of the College of Medicine's Department of Pediatrics, using patient stories to illustrate the progress made in half a century. In the 1950s, Kentucky's Governor Happy Chandler was adamant that no Kentucky child should be forced to travel across the state line to receive the best medical care available anywhere. Thanks to Charlton Mabry and his protégés, they haven't. Dr. Mabry's Distinguished Service Award reads, in part, in recognition of outstanding service to the children and families of the state of Kentucky. But we know that in aiding this population, he has saved lives and improved the health care of hundreds of thousands of people across the country and around the world. And that is why Maryville College is proud to claim him and proud to present him with the college's Distinguished Service Award.